Hi guys, um, it's me. I'm so sorry. Gosh, I hate that when it goes all bouncy like that. It hurts my eyes. Okay, I would like to put out a call for papers. That's what we usually call it in real medicine. I'm going to put out a call for papers. Now, this means that in this case, for this virtual medical school, we're calling on the public and friends and spouses and patients, especially of dysautonomia or related diseases, to send us a letter, give us your age, your male, female. Were you born with it? Were you born with dysautonomia? Did it happen after an accident? Did it happen after a virus? Did it happen after trauma, like a car accident? I mentioned that was my case. Were you born with it? Do you have familial dysautonomia, which is a autosomal recessive gene that runs in mostly the Jewish population? Our brothers and sisters who have the benefit of knowing more about Christ than we do from that Jewish perspective, which I love. Anyway, I need letters. You guys have already sent me a bunch. I need your permission to use what you've already written to me on Dysautonomia MD, if that's easier for you. And what we'd like to do is compile them all in one spot so that, you know, no matter what happens, the test of time will show that we'll come up with 5 or 10 letters today and 5 or 10 letters next month, and 10 years from now maybe there'll be 10,000 letters, and out of that we can make some sense out of everything. So we need it to be scientific. Typical doctor's note. I'll use myself. 49-year-old female. Diagnosis dysautonomia after car accident in April of 2006. Diagnosed by tilt table test. First time I took it, it was negative. Second time I took it, it was positive. And I passed out for 22 seconds. A list of current medications would be really nice to list, you guys. I need that list of medications, okay? Some people are taking beta blockers, some people aren't. I can't take a beta blocker because my heart rate goes down to 35 when I sleep. And they almost tried to give me a beta blocker in the hospital once when they were trying to tell me I had a heart attack. And instead of anyone telling me I had a heart attack, they just dispensed the pill and expected me to just take it like a robot. I'm like, no, I can't take a beta blocker, crying out loud, after everything I've been through. All I need is a heart rate of 25 in the middle of my sleep. So understand also, Mike, as an anesthesiologist and as a patient with dysautonomia, that the circulatory system, God made it so that we can always get blood to our head. Okay? So if your blood pressure goes down, your heart rate has to go up in order to compensate for that decrease in blood pressure and keep the blood flow going to your brain. So it's like a yin and a yang. Your blood pressure and your heart rate, between the two of them, you've got to get blood to your vital organs, your brain, your kidneys, your liver, your GI tract, everything, okay? So that's just my concern with the beta blockers. A couple of you have mentioned being on them. I worry because then you might lose your tachycardic response, which is the natural body's response to increase your heart rate if your blood pressure is low. However, if you are constantly hypertensive and tachycardic with a high heart rate, And then it seems like these are more of the hyperadrenergic POTS patients where your adrenal gland might be kicking in. You have a lot of epinephrine going around in your body that increases both your heart rate and your blood pressure. So I could see a beta blocker helping a little bit with both, but I'm not here to practice medicine. I'm not here to tell you what to do. I'm not here to tell you what to take, what not to take. We're here to gather information. We're not giving medical advice. We're happy to give general information. You could give us specific questions, but I just have to tell you that this is a disclaimer, that this is only a platform for invisible disease, the invisible disease of dysautonomia. So we can try to collect in one place some scientific data that MD level and PhD level people can turn into some solid research. Help us. We need data. Okay? Everybody wants help for dysautonomia. Okay? We're doing what we can, and we can't do it without you. So please send me your age, your sex, how old were you when you got dysautonomia, or whether you were born with it, how you got it, accident, virus, vaccination, high fever, idiopathic, just unknown, or familial. And also, please give me your list of medications. I need the drug name. I need the dose, the number of milligrams. I need the frequency. Once a day, 2 times a day, or 3 times a day. Let's try to get this together and compile a little, handful of cases of people and see what we can find out, okay? So the time is now. Let's start, you guys. I want to try to see the letters rolling on in, okay? And if you already wrote me and gave me all those answers, say it's okay for us to copy and paste that information into a new letter to this separate website, okay? Just give us permission. You don't have to. We know you're sick. Who has time to rewrite everything 1,000 times? You guys do that every time you go see the doctor, and you're not going to do it here, okay? Take care. Send me stuff. Send me information. Send us work to go on, okay? We're here for you. Flood us. We're waiting for the flood. It's time for the avalanche. When is it coming? I don't know. I guess I'll have to check later. I'm looking at my watch here.